Hello, my name is Alex Bernstein, and I'm here with Josh Ernst and Jaden Goldglance to present the final COVID project. So, our mission has been how to be proactive against future pandemics and, of course, the current pandemic. And we've accumulated a lot of research over time. And some of the things that we focused on and collected are masks specificities, not just wearing a mask, but what type of mask to wear, what type of mask is best, safe but practical guidelines, analyzing what works, what doesn't work, and that things are going to need to change as time goes on. Vaccine rollout, which of course is the most important thing. A mask guidelines can't replace a safe and effective vaccine, which we have now. The importance of tracking and breaking down the cases which we have used to guide our research. And lastly, another important process is innovative approaches. And this is also key in the word of being proactive and actively and effectively protecting against COVID-19 and possibly other future pandemics. What we've learned how masks work and which ones are the most effective. We've learned how to properly track variants as well as cases across the country, what that means. We've also learned a lot about vaccine storage, vaccine rollout, vaccine testing, different parts of that. Of course, we have guidelines, which we mentioned, the most safe and effective guidelines. And then we're going to be laying out some innovative ideas that we have, some that are already in use, some that are new, but that aren't being properly utilized in our opinions that can be used to be better proactive. Starting out, we need to go back to what we learned at the very beginning of the year and building a better mask. There's lots of factors you need to consider in building the best mask. Some of the best examples that you can see here are the Sono mask. What is the Sono mask? The Sono mask is made by an Israeli startup company called Synovio Tech, and they created a top-of-the-line mask that we based a lot of our research on, and we get a lot of our ideas from. It's more than 90% effective against COVID-19. And the reason before this is not ordinary. It is made of cotton and polyester. You can see right there, the man on the right is wearing a Sono mask. It looks very ordinary, but it is infused with metal oxide nanoparticles, which actively destroy the COVID-19 particle. We've likened it to a microscopic warfare of the virus. Instead of just creating a blockade against the virus like the N95 mask does, which is also very effective, it actively destroys the virus when it enters the vicinity of the mask. And we're going to go into this why nanotechnology can be properly used in all aspects, not just masks, but also vaccines. Next, you have, of course, the N95, the KN95. The reason these are so effective is because of polypropylene. But it's not just the fact that they have polypropylene, because surgical masks also have polypropylene, but it's the fact that it's a high concentration of polypropylene, as well as a tightly fitting mask around your face. And that brings us into our next question. Why are these effective, and do all masks properly protect against COVID-19? And the answer to this is actually no. COVID-19 travels in the air, and it travels in different particle sizes. One of the most common particle sizes is 0.3 micrometers, which is very, very small microscopic measurement. And the problem is that cloth mask and surgical mask and any other common mask doesn't protect against that size. That size can go right through the mask. So if you really want protection and you're telling people you can wear a cloth mask, you can wear a surgical mask, and they're going into a high-risk area, they're not really going to be protected. And we think that that's part of the problem. You can use a polypropylene filter, which is better than just a cloth or surgical, but even then, it's not the same as having an N95, a KN95, or a Sono mask. Of course, the N95 is the top, KN95 is slightly less effective, and the Sono mask, which is also very effective and is in fact being used right here in America. There's a fulfillment center now in Connecticut and other parts of the country. Now we need to talk about mask innovation, and a lot of this comes from the Sono mask. You need to focus on what I call the big four. And something that I don't think is being utilized enough today, and I think should be utilized if you want proper protection. The first thing, as you can see, is a proper fit. We've come to the realization that we're wearing leaky masks. And what I mean by this is we're wearing a mask, but and when understanding particle transmission, lots of virus can just escape out of the sides of your mask, the bottom, the top, or even through, as I discussed, with the micrometer scale. Another thing I touched on is filtration. When you're wearing a surgical mask, yes, it does have polypropylene, but polypropylene needs to be highly woven and highly concentrated. What polypropylene is, it's a macromolecule, which means it's a polymer made of isopropane units, and that's the chemical design. It's a plastic material that's lightweight and low density, and it was commonly used in rope, carpet, packaging, and even automobile parts. But the reason it's so effective is because of how tightly woven it is, and it can stop COVID, the particle, from penetrating the mask. And that's why I recommend things such as particle filters and N95 masks, which have the highest concentration. And then something that's also important to discuss is using proactive technology. And I touched on this, the nanoparticles. Nanoparticles are used all over for various things. Nanoparticle is basically the study and application of very small things, to put it simply. That's what nanotechnology is. It can be specifically designed to fight and kill COVID-19. And we think this is a big factor. That's why the Sono mask is so effective. I think that in America, of all places, where there's so much innovation, I think that we can do it better than anybody. And I think that's something that isn't being explored enough by technology companies, by pharmaceutical companies. I think that can really change the game in preventing COVID. And that all leads to effectiveness. How effective is it really against fighting COVID? If you're wearing your cloth mask that you made or you bought, is that really going to be effective? And the answer is probably no, because it doesn't have the things that we listed.
My name's Jaden Goldglance. So tracking cases today. Cases today are actually at their lowest since last October. And as you can see on the map from Johns Hopkins, if you click on the link, you'll be able to see that on the East and West Coast, cases have dropped significantly. And with the distribution of vaccines throughout the country and the proper use of masks like the Sono mask or KN95, we can continue down this road. And for example, states like Texas have actually reached 0 cases. And also Maryland reached its lowest case count since last March. And if you could go back to the slideshow for me, you'll be able to see that the case count is 33,802,543 with 27,299,180 recovered. And I believe that if we keep doing what we're doing, we will see more examples like Texas and Maryland throughout the country.
Yeah, and this all goes back to using practical and changing guidelines. Of course, Texas hit 0 deaths last month because of their changing guidelines with what is happening in their state.
My name is Josh Ernst. I'm going to be talking about variants of COVID, specifically the B1617 variant, which was recently categorized as a variant of concern by the World Health Organization. It was initially found in October and has been tracked in 44 countries, and in the US, 3% of tested samples are the B1617 strain. This is the variant that is causing trouble in India. They recently set the record for deaths in a day with 4,500. This variant is believed to be more contagious than the original COVID-19 virus, yet there's no clear evidence it causes more severe symptoms or more deaths. The same public health measures, masks and social distancing, can prevent the spread of this virus variant. Next slide.
And at the end of the day, tracking all this information can lead to a better understanding and better information. Companies can use nanotechnology, they can use polypropylene and discover other materials that can better fight against COVID. Of course, nothing is better than the vaccine, which we're seeing being rolled out. And that's something we've also gone into as effective vaccine rollout. So we can understand this information, take in these factors, and build a proactive approach. Thank you.
I have one more slide.
Oh, sorry about that, Josh. I didn't realize one more slide.
So what can we do about these variants? We must test as many people as we can. And to do that, we have to incentivize people to take COVID tests, because we need the data and people won't be willing to submit to the test if to their knowledge they are not exposed to the virus. Also, some people don't want to know if they have COVID and be forced to quarantine and know if they're contact traced and stuff like that. So these tests are completely anonymous. I think we incentivize and don't take any personal information from the test subjects who are entering the country through airports or other borders, or even leaving large crowds such as sports games. We can successfully contact trace and index these variants coming in and act accordingly. Now we're done.
That concludes our presentation. Thank you.